You're welcome. I congratulate you for successfully completing the ECG Level 1 course. But now that you have completed the ECG Level 1 course, the truth you must know. There are some things we could not tell you at the beginning of the course, but now that you have come to this stage of your learning exercise with us, it is important that we share this truth with you. It's our truth, our sincere information to you that we think will be necessary for you on your next journey. So once again, I congratulate you. The journey was not an easy one. It took a lot of sacrifice from both the team and the students to get to this stage of the training. You did a great job and we are proud of your achievement. So for all the drills, times you have to stay late at night, trying to fulfill your assignments in spite of your very busy schedule and all, we are aware of all of these difficulties, and so we congratulate you. So it took a lot. Many people started the course, but not everybody was able to finish it up the way you were able to. So congratulations for coming this far. Now, some truth we did not tell you at the beginning of the course because we needed you to put in as much effort as possible. But now that you have gotten to this stage, we must tell you the truth. The first is that ECG, as you have found out already, is a very complex subject. Many people find it difficult to understand at their first attempt on learning it. For example, when I started up with my ECG interpretation learning process, I attended classes multiple times, close to 4, 5, 6 times. And after each class, I left angry. I was frustrated. I wasn't happy that I wasn't getting the secret behind it. But with continuous practice and continuous work, I will show you very quickly some things you need to do to ensure that you become proficient at ECG interpretation. So we did not expect you to gain everything or to know everything at your first instance. It's understandable that you are feeling the way you are feeling right now. It's understandable that you may be hurt that despite the effort you put in, you still have not gotten that level of in-depth understanding that you desire. Our research has shown that many participants, or even most, would need to review the course material. That's the videos, the live lectures, the drill submissions that you made, and even the manual we shared with you. You may need to review it at least 3 times before they come to a proper understanding of the concepts. So class was mainly an introduction to what you need to know. We just gave you an insight. Now it is your duty to go back and intimate yourself better, study those materials in-depthly. So we did not expect you to master everything, and we expect that you still have some level of challenges interpreting the slides. It's not a strange thing that you still have those challenges. However, some things you must do as next step actions if you want to become proficient at ECG interpretation. So the first thing we recommend is that you review the course at least 2 more times within the next 6 months. Luckily enough, all the course materials are available to you, and that's one reason why we prefer the online course to just a live class, because during a live session you only have one shot with the instructor, but with these recorded materials that you have at your disposal, you can go back to them from time to time. So try to review the materials at your own pace at least twice within the next 6 months. Create small groups. We encourage you, find out people from your various drill groups that you think are of like minds. Form groups of 2, 3, 4, 5 people. Groups that you can interact with and share and review ECG slides together. It is practice that makes perfect. Deliberately attempt to analyze every ECG slide you come across. Don't overlook them. Don't just look at them and pass. Deliberately, you are in the process of learning. Your learning process has just begun. It needs to continue for you to become exceptional or competent on this subject matter. So every ECG slide you see in your clinical sector, anywhere you see an ECG slide online, attempt to interpret it, attempt to do justice to those slides. When they prove difficult for you, seek help. The more questions you ask, the more help you seek, the clearer this concept becomes for you. So seek help, ask questions when you have difficulties. And one of the very important things we encourage people to do is to register for the level 2 course. Now, the level 1 is an introduction to ECG. It doesn't really cover using ECG or utilizing ECG as a clinical tool for solving clinical problems or reaching clinical decisions. It's more of an introduction to ECG usage. So I encourage you to register for the level 2 course so you'll be able to better utilize ECG as a clinical tool in real life cases. Remember that knowledge is only valuable when it can solve problems. And the level 2 course teaches you on how to use ECG in actual disease diagnosis and clinical intervention. So I encourage you, register for the course. It's a 2 weeks course, 14-day course, and I know definitely you'll be glad you did. So this is an outline of some of the content of the level 2 course. So we're looking at ECG usage in disease diagnosis and clinical intervention. So we're looking at chamber enlargement, ischemic heart diseases, conduction abnormalities, different arrhythmias, and other pathologies of ECG. So register for the ECG level 2 course and take your knowledge to the next level. So once again, I congratulate you for making it this far. I thank you for your time, your sacrifices, but the truth is this: the journey has just begun. So see you on the level 2 course. Thank you.